We spoke to a number of thought leaders who were present at the conference and also people who were speakers presenting. And we found out what were the trends and innovations in UK dentistry at the moment. And we're proud to present this to you in this special broadcast. Hi, I'm Marita Kritzinger and I'm at the Dentistry show in Birmingham at the NEC. And I'm speaking with Seema Sharma, who is not only a dentist, but has developed a product for CQC, and she's going to tell us a bit more about that. Seema, thank you for joining us.
Thank you for having me, Marita.
I'd like to ask you a bit about the product you've developed. There's a lot of CQC content out there in UK dentistry currently. What does your compliance cloud do differently?
Well, the compliance cloud is based on cloud computing, and we're all using cloud computing with online banking at the moment. So the future of information storage is on the net using cloud computing. And everybody is talking about that at the moment. There was, in fact, something on the BBC this morning. Now, what's different about us is that CQC is going to require documents and storage and evidence for the rest of our careers and forevermore. So that information needs to go somewhere in a logical, structured fashion, and there is no better place than putting it onto a site such as the DentisTv Compliance Cloud, because we have put together a list of all the things people need, what they need to put up there, and you just attach your things to your evidence, your audits, your documents, no matter where you source them from, the BDA code, Smile-On, doesn't really matter where you do all your training from and how you get your information. The important thing CQC are going to want to see is what did you do with that information in order to show that you improved outcomes for patients. So we store all of that, and we have a task manager which reminds practice managers when things are going to expire, what else needs uploading, and by doing that we effectively have created a virtual practice manager online, sitting on people's desktops.
Okay, and what sparked your interest in CQC and looking at it from a practice management perspective, with you being originally a dentist?
Well, to be honest, my managers. I run practices, and when I told all my managers that I wanted them to be registered managers, they all had a minor heart attack and said, Seema, with the best will in the world, trying to remember the dates of absolutely everything and getting everything done on time, whether it's servicing, contracts, critical exams, induction plans, all of that is date sensitive. How on earth are we going to do this? How many spreadsheets are we going to need? And I thought we need to come up with something better to make their lives easier, because they weren't sleeping at night.
Transform your CQC compliance management and your life with a DentisTv Compliance Cloud, a virtual dental practice manager, guaranteed to save you time and money. With built-in audits, report generators, gap analysis, document storage, reminder systems and training packs, maintaining compliance is easy. To book your demo, call 020-8297-9100 or email info@dentibite.co.uk.
In terms of the accessibility that you mentioned of this particular cloud, what kind of investment does it take for a practice to start using your cloud?
Right, well, because it's online, it is incredibly affordable. You don't need any hardware. You don't need anything other than internet access. So we have put the software in a place where you just need to be able to get to it, whether you get to it through your PC, whether you get through it through your iPhone or your iPad. We've also created functionality whereby you could take an iPad around your practice, pop your validation reports in your decontamination room, show it to a patient, put the patient's survey on, everything you need to get all your outcomes put on live. And the cost is £125 per licence. That's all.
And once someone registers to start using the cloud, how do you have any advice for someone to find their way around the system in terms of the navigation?
Yes, indeed. We've laid the whole system out, outcome by outcome, in the exact format that CQC use. So it is absolutely a no-brainer. You just log on and you work your way through from outcome 1 down to outcome 28, pop all your things on and you're good to go.
Fantastic. Thank you very much, Seema. I'm speaking with Mari Coxon, who is a dental hygienist, and she's also the clinical director of CPD for DCPs. Mari, thank you for coming onto our show. What I'd like to ask you is what you presented on as part of the dental hygiene program yesterday to the group of hygienists and dental therapists.
I kind of blended really well with what's been happening at the whole show actually, and it was all about ethical selling and using prevention as a builder of trust and a tool to build a relationship, and how to actually close on a sale of a piece of treatment that is not essential but is an elective piece of treatment, and making people comfortable with that, because hygienists and nurses sometimes find it difficult to sell comfortably to patients.
And were there any interesting questions that some of the audience members asked you?
We had a little group discussion at the end, and I think probably the hardest bit was that a lot of people feel that they are already naturally doing that because part of their diagnosis is finding out about the patient's lifestyle, and so they're already building that relationship, and tends to be the person in the practice who's least likely to be building those foundations. Unfortunately, don't want to be a basher, but it's the dentist. So I think what we were saying is, we need to work as a team, spread the message to the team, and make sure that the team is all doing the same thing as well.
Okay, and what do you enjoy most about being a hygienist? Do you think it's a good career?
I love my job. I love my patients. I love seeing someone who's had real problems, turn it around, get healthy. But I equally like keeping someone who's healthy, and just going through people's journey of life, because we all get hit by things throughout our life. There's no easy life. There's always ups and downs, and just supporting people, it's a great job to do. And now that I'm doing the training as well, I'm helping to make other people feel like I do in their job, and going into practices and helping them make their practice like I dream about every practice being. So it's a good job.
Mari, thank you very much for your time. I'm speaking with Tricia O'Hare, who is the editorial director of Hygiene Town, a publication for hygienists in America and also internationally. Tricia, thank you so much for speaking with me. I'd like to ask you a few questions. You are presenting at the Dentistry show for the hygiene program. Can you tell us a bit about what you are going to be speaking about later today?
Yes, I'm going to be speaking about biofilm and how xylitol can penetrate the matrix of a biofilm. It's quite exciting, actually, that a natural sugar, as something that's sweet, can be a solution to something that's a big problem like tooth decay and gum disease.
And xylitol seems to be not as well known, particularly in the UK amongst the hygienist community. So how are you going to convince them that it's a great solution?
That's a wonderful question. I've been wondering that myself. The research has been out for a good 30 years, and it's not just in the UK, it's also in the US that the hygienists are not really paying attention to the research. I think sometimes they think it's too good to be true that you could actually reduce plaque on the teeth by 50% just by chewing gum 3 to 5 times a day. I can't get that result teaching people how to brush and floss every day, so it really will make a difference, and I'm hoping to show a lot of cartoons along with the science to make it fun, give them some sound bites, and make it interesting, and give them something fun and sweet and successful for their patients.
And so you must interact in your role as editorial director for Hygiene Town with loads of hygienists and dental therapists from around the world. What are some of the trends and questions that always come up that people ask you, and what are you noticing in the hygiene community in terms of where it's headed in the dental team?
What I do notice from the hygienists all over the world is that the questions are often quite the same about how to treat patients, what's the best way to treat patients, how do you find the best instruments, the best approaches, how do you get enough time in your schedule to actually do what you need to do, how do you deal with the patients who don't seem to be motivated, those same kinds of questions. What I do notice as a trend between all of these hygienists is their sincere dedication to making patients better and to really sharing with patients what they need to know to be successful in preventing dental disease. And I'm surprised and feel very good to know that so many hygienists are really committed to their patients' well-being above their own position as a job.
And what do you enjoy most about your work?
There's so many facets I enjoy. I think it's the fun part is meeting hygienists and dentists from all over the world and interacting and realizing that the community of dental hygiene is really quite small internationally, and we all are working on the same goals and same objectives.
And apart from xylitol, what else is big in the field of hygiene that all hygienists should be aware of?
Well, this is a bit self-serving since I've done the research and written the book about it, but dry toothbrushing is really an amazing way to teach people how to actually get their teeth clean. And the research comes from UK researchers in the 70s, brilliant men who did something they can't do now, and they videotaped people brushing their teeth without their knowledge. We can't do that anymore. People have to know, and if you tell someone you're going to videotape them, they're going to brush for 10 minutes. But if you teach people to brush inside on the bottom teeth first, brush the whole mouth till the teeth feel clean and taste clean, and only then add your toothpaste, you're actually going to reduce the buildup on the bottom by 63% and bleeding by 55%. Something so simple and easy as dry brushing inside first.
Okay, well, Tricia, thank you so much for your time and for speaking with me.